Hello. Thank you very much for this wonderful invitation. Unfortunately, I cannot join you live because right now I'm in Utrecht, the Netherlands, where I just gave a keynote address at the European Congress on Global Health. I shared to nearly 2,000 scientists, scholars, and practitioners the climate and health story of the Philippines, the efforts of our different sectors, and the resilience of the Filipino people. But it's hard to say no to an invitation from my alma mater, the University of the Philippines, Manila, and from my friends at the College of Public Health, Department of Environmental and Occupational Health, and of course, Healthcare Without Harm. I used to be part of Healthcare Without Harm Southeast Asia, and I continue to be an ally and collaborator and comrade in trying to green the health sector and improve the climate resilience of health systems in the Philippines, in Asia, and worldwide. Today, I'm going to talk about the future of the hospital in the era of climate crisis and planetary health. I understand that in the past several 2 days, you already had the chance to talk about many aspects of climate smart healthcare. How do we build the resilience of health systems, but also to reduce the carbon footprint? And so I hope that this presentation will not only reinforce what you already learned, but also will help you envision the future of the hospital in the long run. And I want to begin by defining and describing the concept of planetary health, which is mentioned in my title. I'm currently leading the first planetary health program in an academic medical center in the Philippines and Southeast Asia. And planetary health, this new powerful concept, basically just reminds us that the health of our people and the health of our planet are inextricably intertwined. In fact, they're inseparable. And I always remind my medical students, the future doctors of our country and our world, that now in the 21st century, we have two patients, not just the people, but also the planet. And this is the situation now of our planetary health. Of course, over the past 3 years, we've been very concerned about waves of COVID-19, as you can see in this cartoon. But I think this convening is also emphasizing that we cannot anymore ignore not just the future waves, but future anticipated tsunamis of climate change and biodiversity collapse and all their myriad consequences on human health, but also to health systems, to the health sector, and even to our hospitals and other health facilities. And planetary health really is founded on this idea that our health is now shaped by the environment, the changes in the environment, which are in turn driven by a wide array of human activities. Many of them are damaging to the environment. Many of them are destructive, unfortunately, in nature. I'm introducing a new term, the Anthropocene. Anthropo, of course, we know means man, anthropology, anthropometrics, and anthropogenic, because the changes now that we're seeing in our global environment are anthropogenic, human-induced, human-driven, driven by, for example, as you can see in this diagram, our consumption patterns, the demographic shifts that we see, like rapid urbanization or continuous population mobility and migration, and technological advancement. Everybody's looking forward to acquiring the latest version of whether it's the iPhone or any kind of gadget. And all of these human drivers are then creating a wide array of ecological damages. We are talking now about climate change. I already mentioned biodiversity loss, but also different kinds of pollution to the air, water, and land. And all of these, we know, are going to impact the health of ourselves and of entire populations. On your right, you will see that every single disease group is going to be affected by the changes in the environment induced by human activities in the epoch or the era of the Anthropocene, our nutritional status, infectious diseases like dengue or even future COVID-19s, non-communicable diseases, perhaps due to exposure to air pollution or intense heat, displacements of entire populations, which can lead to future conflicts, and of course, even mental health, the health of our brains and our hearts are usually largely influenced by the changing environment. And so we need to start talking about the future of our health, the future of our health systems, and the future of the hospital in the era of the Anthropocene. And to further inform our thinking around the future of hospitals, it's very important to not only understand and measure and assess the health of our people, but also the health of the planet. And this convening is focused on climate change, but we have to remember, which I already alluded to a while ago, that we are currently facing a wide set or array of planetary threats, existential threats that can jeopardize, endanger the future of humanity. And I want to introduce to you the concept of the planetary boundaries, which was developed by colleagues from the Stockholm Resilience Center in Sweden. When we say boundaries, these are limits that cannot be violated or breached, because if we do so, then it makes the planet less conducive for human survival, for human health, for living. And in this diagram, you can see that there are 9 planetary boundaries that have already been identified. And unfortunately, out of the 9, 6 are already violated or breached. Let me just enumerate those. Climate change, because now our global climate system is continuously being destabilized by still the ongoing emissions of carbon and other greenhouse gases into the atmosphere. Biosphere integrity, over the past century, we've seen the fastest rate of extinction of creatures great and small, and we know that in preserving the integrity of biodiversity of our ecosystems is critical for the provision of natural medicines or food, and for the survival of all other species that are critical for the preservation of our environment. Land system change is also has also been breached. Unfortunately, we've been turning our natural ecosystems, rainforests, into farmlands or subdivisions or golf courses or new cities. Freshwater change also has been violated, because now our lakes and rivers are not only overconsumed because of overpopulation or increasing needs, for example, in cities or for agricultural purposes, but also we are now seeing or witnessing over-contamination of all these bodies of water with all the products, chemicals that we're releasing into the environment. Biogeochemical flows of phosphorus and nitrogen have already been disrupted as well because of our addiction to artificial fertilizers, for instance, in the pursuit of large-scale agriculture. And finally, novel entities has also been violated, the boundary for novel entities, because we've been manufacturing and inventing new chemicals that we release to the environment. One of the most important examples is plastic. And now we see plastic not only floating in the oceans and seas, but also now flowing in our bloodstream, as discovered by Dutch scientists just last year. And so 6 out of 9 boundaries, this should be a cause for alarm and a call for urgency, for urgent action to us, to the health sector, but also to the hospital community. And, the health sector is not, is also part of creating, these existential threats, these problems, these environmental challenges. We're not exempted from, I would say, the planetary health crisis that we're facing. This is a study that was published a few years ago, which tried to estimate the ecological footprint of the global health sector. And just by eyeballing in that diagram, and as you can see, it's very similar to the planetary boundaries framework a while ago. Basically, it just shows that the health sector is also contributing to the violation of the boundaries, greenhouse gases, contamination of water, the disruption of the biogeochemical cycles of other important compounds, but also air pollution, among others. And then on your right, you will see, and it's from another study that, and this is from Europe. We don't have, unfortunately, very good numbers for Asia. Maybe that's a future research that needs to be done. But as you can see, the share of the health sector's emissions as part of the country's total emissions is also significant, especially for countries with more advanced healthcare systems. And this is from Healthcare Without Harm, and maybe they've already presented these numbers or these pie charts, but I just want to emphasize that healthcare is contributing to emissions through different sources. We have scope 1, those that are emitted on-site, scope 2, those are that are emitted off-site through the electricity grid, and scope 3 through the supply chain, the medicines that we purchase, the food that we procure and serve to our patients and staff, the travel that is entailed in, for example, the delivery of healthcare through our ambulances, etc. So all of these are contributing to carbon emissions. We have our own share in the climate crisis. And even if you look at parts of the hospital, you can see that different aspects of the operations of that section of the hospital, for example, in the operating theater, actually also contributes to carbon emissions. And this is a very interesting study by a colleague and friend, Andrea McNeil from UBC Vancouver. And you will see that, different operating theaters have different sources of emissions. And this is something that we may want to do also in Southeast Asia, for instance, measuring the carbon footprint not only of entire hospitals, but of specific sections of hospitals that we know are carbon intensive, so that we can find ways and develop strategies to reduce the emissions from healthcare delivery. Meanwhile, while the health sector is contributing to emissions, to pollution, the health sector is also not very ready when it comes to the impacts of climate change on human health. We're not resilient, we're not adaptive. And just last week, the Lancet published the 2023 version of the Lancet Countdown on Health and Climate Change. It's an annual report that monitors progress, both the impacts of climate change on human health, but also the health sector actions to address climate change. And, I will not belabor you with the details. You're seeing some really, scary numbers, how climate change is going to lead to more heat-related deaths or food insecurity or dengue increase. Now we're seeing dengue in parts of the world that they used to be non-existent because dengue is a tropical disease. Now you can find it even in temperate regions like Europe. And so the question is, are our hospitals ready for what I just described to you a while ago? Those impacts of climate change that are now being documented, that are projected to increase in the long run. And of course, it's not just the hospitals, it's entire health systems that should be resilient. But we know the vital role that hospitals play in healthcare delivery. But unfortunately, the medical community in general is operating or continues to operate as if the global climate system is doing okay. In fact, it's not just that we're unready for climate change. We're also contributing, as I've said, to climate change. And during these past 3 years, during this pandemic or past pandemic, we've also even created new forms of pollution, like plastic pollution or PPE pollution of personal protective equipment. Now you can see them floating again in our oceans, in our seas, in our rivers. And so that is just a consequence of a healthcare sector that does not have environmental sustainability as part of its DNA. Right now, it's more of an add-on or ad hoc or something extra that we're doing. And now we need to ask the question, are we ready to build health systems that consider the climate? As a teacher of medical students, I always ask myself, are we ready to produce the next generation of health professionals who care not just for the people, but also the planet? And maybe we should be asking, are we ready to design or redesign our hospitals that centers environmental sustainability in its operations, in its design, in the way they are planned, in the way they are run? And we know that hospitals are important. That's why we're having this convening, especially in the past few years and even in the past few weeks, we have realized how vital how essential hospitals are, not only in terms of healthcare delivery, but hospitals also have huge implications even for environmental sustainability and even for peace and security across the world. We've seen hospitals being overwhelmed during COVID-19, but also forced to innovate, to come up with new ways in order to absorb the surge, of patients resulting from epidemics. We have seen, and even especially here in the Philippines, we've been seeing hospitals ravaged by typhoons and flooding. And the question is how we can make sure that hospitals bend without breaking, that they are the last building standing when climate-related disasters strike. But also we've seen how hospitals are being weaponized, being used by people as a refuge, but also being attacked by different forces. For example, in places of conflict. And I just want to echo, and while this is not at the heart of our topic today, we cannot just ignore the fact that hospitals should not be a target for conflict, for war. There are international instruments that govern the protection of hospitals and health systems. And if we have those instruments in the context of conflict, now is the time to also look at how we can protect hospitals in times of climate crisis. And over the past 3 years, also there has been a avalanche of articles written about the future of the hospital. Some focus on ensuring that hospitals are not scary places, are places that really make patients not only healthy but also happy when they leave the facility. Some papers have focused more on the role of digital technology and even artificial intelligence in making hospitals, quote unquote, smarter. And then there are also articles saying, or even telling us that the hospital of the future won't be what you expect because they don't have walls, they go beyond the building, and maybe the hospital of the future will even be your own home. And we've seen that also during the pandemic, when a lot of the for example, testing, self-testing, self-care, home management were done not in the facility, but instead in the home, in order to ensure that infection is not spread, to ensure that hospitals are not overwhelmed, and we focus the resources on those who truly need advanced hospital care, and also to protect people. And we know that homes can also be the safest places, especially in times of pandemic, and also maybe in times of climate crisis. But yes, there will be revolutions in the way we design or redesign healthcare, including the hospital, through decentralization, through strengthening the connection between the hospital and the community, or even deloading some of the functions and putting them at the level of primary care or even at home. But the hospitals, nonetheless, are here to stay. And we need to think about how to solve the climate crisis one hospital at a time. This is an article that I actually wrote in 2016, when I think there were only a few hospitals, not only in the Philippines, but around the world, that have begun thinking about climate change, environmental sustainability. And I also want to borrow this quote from Healthcare Without Harm, that perhaps our future vision should be hospitals that are agents or vehicles of regenerative healthcare. Hospitals that do not only sustain life and health, but also repair and restore what has been degraded or lost. And so maybe this is really where we're headed to. And I think, there are already emerging discussions about how to center this in the design of the future hospital. I also want to call your attention to this new report from the World Health Organization European region, which I think is still very applicable for the Western Pacific region, for the Southeast Asia region of the WHO. This is a technical brief on rethinking the architecture of hospitals. And, I just did a screenshot of the table of contents just to show to you what are these different elements that we are now talking about when it comes to rethinking, reimagining the architecture of hospitals. We're not anymore just concerned about what's inside the hospital, the interior, but also how the hospital engages with the community, with its environment, both social and natural. And again, here you will see we're looking at issues like where to place the hospital, how to connect the hospital to different parts of the health system, how do we maximize natural landscape and healing outdoor environments. And then if you go to the inside of the hospital, we're now talking not only about functional design and infrastructure sustainability, including environmental sustainability, but also making hospitals safe working spaces and ensuring safety and security for patients and staff alike. And also digitalization, as you can see there, and even improving the internal, or the indoor environment. We've ignored, for example, improving indoor air quality during COVID-19, when we learned that the airborne transmission of COVID-19 is already established. And so how do we incorporate all of these into the new agenda for future hospitals? I'm sure you already discussed climate smart healthcare. Just want to emphasize that it's really the convergence between sustainability and resilience, reducing our emissions, but also adapting to the changes, making sure we are the last building standing, while at the same time, we're not harming the planet, as we also made a commitment to not harm people and patients. And these are just a reminder of the different sources of carbon in a healthcare facility, which I already mentioned a while ago. And in 2021, I worked with Healthcare Without Harm in doing some modeling exercise to answer the question, is it possible to keep on expanding universal healthcare to people while at the same time decarbonizing the health sector, reducing its environmental footprint? So just by eyeballing this graph, you will see that it's possible, as long as we do, what Healthcare Without Harm calls the 7 high impact actions, shifting to renewable energy, zero emissions buildings, zero emissions transport, healthy and sustainable food to serve inside the hospital, incentivizing low carbon pharmaceutical procurements, applying circular healthcare and sustainable healthcare waste management, and establishing greater health system effectiveness to reduce wastage in the resources that we use. And I'm sure Healthcare Without Harm also has shared with you this agenda already. I'll not go into the details. You can see at least there are 10 areas that we can work on to improve the environmental sustainability of our healthcare facilities, including hospitals. I encourage you to visit the Global Green and Healthy Hospitals website. So one of my hobbies when I go around the Philippines is to take photos of hospitals that are already embracing solar power, for example. And so this is something, that is perhaps low-hanging fruit, something we can already do soon across many hospitals in the country. And then I just want to cite some examples from outside the Philippines. Taiwan is leading, for example, in terms of healthy and sustainable diets being served to their patients and staff. So this one is from the Dalin Chuchi Hospital in Taiwan, where they're already producing the food within their own backyard, therefore reducing the carbon footprint, not only of large-scale agricultural production, but also long-distance transport. And then now, when it comes to resilience and adaptation, this is a framework from the WHO, which basically reminds us that we want health systems that do not collapse, that recover better than before, and even transform in the face of climate-related shocks like a typhoon, a cyclone, or stresses like food insecurity or outbreaks. And so I just want to invite you that the WHO just released this update of the operational framework that they developed early in 2015. But this time they have combined climate resilience and low carbon healthcare into a single framework. So hopefully this is going to be useful for many of you. And this is what we're using now in some of our projects at St. Luke's, working with local communities, trying to, again, improve their climate resilience by looking at their health plans and their climate plans, making sure that they talk to one another, and also doing some facility assessments and capacity building of health workers, from the doctors all the way to the barangay health workers. And then we need to also start incorporating climate smart healthcare into pandemic preparedness and response. I just want to share this report that I co-wrote also in 2021, basically looking at how we can incorporate climate resilience and low carbon strategies into the different phases of the pandemic, from preparedness all the way to response and vaccine delivery, and eventually to recovery and the return to normal. We need to also start thinking about the different vertical disease programs that we have. So, for example, I co-wrote this article on HIV/AIDS programming and how climate change is anticipated to affect the way we deliver HIV care, from the early testing all the way to antiretroviral treatment, and making sure that HIV/AIDS programming is also not harming the planet by embracing environmental sustainability. And then we also have, we have to start embracing what we call climate services for health, climate data, and how we can use this for better decision-making within healthcare. And so this year, the World Meteorological Organization actually chose health as the focus of their annual State of Climate Services. And for example, in the Philippines, we have an underutilized tool that is already available, which is Hazard Hunter PH, coming from the Department of Science and Technology. This should be a part of the toolkit of health professionals. Here, you can see my hometown, Calamba. We tried to look at which parts of the city will be inundated by flooding if climate change continues to worsen. And what we're realizing is that there are several health facilities that are actually located in those high-risk areas. So this is a very good tool that we can use for better planning the locations of our future health facilities or hospitals, or identifying hospitals or health facilities that need to be disaster-proof or even relocated. And then we need to educate the next generation of health professionals. And so here I am showing to you the Climate Smart Healthcare course that we offered at St. Luke's, along with Healthcare Without Harm, in 2022. And hopefully we can offer this maybe also with UP, because we need to really create a cadre of health professionals and hospital administrators that know how to, redesign healthcare and healthcare facilities to not be only low carbon, but also to be resilient to climate change. This is another course that we offered early this year. I invite you to visit the website because all the recordings are available to the public. This is a course on climate and health that we offered to nearly 700 health professionals from across Southeast Asia. We offered this St. Luke's along with Healthcare Without Harm and Columbia University in New York. And then this really requires a lot of investment, this agenda. And so, we need to start thinking about investing in, the buildings and relocation and improving the design of our health facilities. I just want to share with you an example from the United States, where a rehabilitation hospital in Boston was, elevated in order to make sure that it can actually withstand sea level rise in the long run. And the Philippines is a country that is facing some of the fastest rates of sea level rise in the world. And we have many communities and hospitals along the coastlines and in islands. And so we should start thinking about how to sea level rise proof our health facilities across the country. So now I'm reaching the end of my talk, the last phase. And I just want to highlight that we in the Philippines are not lacking of policy instruments to guide this new agenda. I'm part of the Climate Change Commission's National Panel of Technical Experts, and at COP28 in 2 weeks' time, we will be launching the National Adaptation Plan of the country. And as you can see, health is central to the country's National Adaptation Plan. And part of the interventions that are needed is to strengthen the ability of our hospitals to address climate change, but also to reduce their environmental footprint. And we are grateful to the Department of Health that we have these manuals and frameworks already available, such as the Green and Safe Health Facilities Manual. This is a good start. And now our challenge is to make sure this is implemented across the country. I hope that the Philippines will also join the ATACH, the Alliance for Transformative Action on Climate and Health, which is a WHO-led initiative. It includes health systems from around the world that made a commitment 2 years ago at COP26 in Glasgow to establish low carbon and climate resilient national health systems. Unfortunately, the Philippines is not yet part of this movement, along with other ASEAN neighbors. So hopefully we will all be joining this very important global initiative. And we need to also tap new forms of funding from, for example, from the climate space. And for example, it's great that Laos, one of our neighboring countries in ASEAN, is the first ever recipient of a health-focused green climate fund, as you can see here, to strengthen the climate resilience of their national health system. Hopefully, more countries in the region will be receiving this support. And then I encourage everybody to also visit these two websites. Right now, I am chairing the thematic working group on climate resilient and sustainable health systems of Health Systems Global, where we are really discussing this emerging agenda around the nexus of climate change and health systems. And then we also have a new Lancet Commission on Sustainable Healthcare led by Yale and the University of British Columbia. And I'm leading the group focusing on adaptation, risk, and resilience. And so I invite you to contribute, provide inputs to these ongoing processes, because this is a global agenda that is rapidly emerging. And finally, I just want to highlight that this agenda will not prosper if we ignore the politics of hospitals. There's politics everywhere. And as you can see here, there are many ways by which politics play into the governance of hospitals, for example. There's politics within hospitals, between departments and within the administration. There's politics between the hospital and the rest of the health system, like primary care and communities. Hospitals are also political institutions, as I already alluded to a while ago. They can serve as a community anchor, but also as a political weapon. But also there's politics now between hospital objectives. Some will say profit and efficiency is primal, but quality and safety needs to be advanced. But also now we have new objectives like environmental sustainability. So we need to be more politically savvy to understand the political dynamics around hospitals if we want our hospitals to be climate smart, climate ready in the long run. So thank you very much for listening to my presentation. Together, let's create the hospitals of the future that will advance the health of both people and the planet. Thank you and congratulations.